You will not be counting minutes to get or maintain a rug level after PDPM because we no longer have rug levels. You will be providing the time to the patient that they need in order to move them toward their goals efficiently. So with the proposed PDPM, there will still be ARDs, but only after 5 days and then again at discharge. There's none of this 5, 14, 30, 60. It is 5 days, discharge, and those ARDs are not tied to minutes at all. Those ARD dates are looking at the patient's clinical characteristics that are documented in the MDS. But here is the big game changer. A SNF would receive a therapy payment regardless of whether therapy services are actually provided. Yes, you heard me right. Under PDPM, the patient's clinical characteristics and clinical diagnoses may indicate that the therapy services are likely needed, but payment is provided regardless of whether therapy services are actually provided or how much they're given or how little they're given. This is a complete change in how we think about reimbursement. I'm wondering though now, now that we're moving to the PDPM model and the rug levels are eliminated, how will our productivity be measured? If it isn't based solely on the minutes we deliver, since we're no longer tracking these for payment, then perhaps our time in MDS meetings may be seen as very productive, as you'll see later as I explain how the PDPM calculates reimbursement. Now is the time for SLPs working in SNFs to start nudging into that RAI process. Talk to the MDS nurse. Ask if you can provide information to help, especially with sections B, C, I, and K.